So I'd like to welcome everyone to our industry roundtable today, hosted by the Health Policy Institute at the American Dental Association. We'll be discussing the latest data and insights on how COVID-19 is impacting the dental care sector. We'll do this with some data presentations, and we're very, very pleased to have a great roundtable joining us today. So there are three things we want to cover today. First, we'll start with an update of our latest data out of HPI in terms of the core indicators we've been tracking. This will be data we collected the week of November 2nd. Second, we have, as we do usually, some thematic questions of the week. This time they'll focus on practice profitability, some questions on student loans, as well as the use of aerosol reducing procedures. And we will also have the latest consumer sentiment data. You'll see our panelists in the latter half. I'll do just a quick intro. Chelsea Fosse is with HPI. She's a senior health policy analyst. You'll hear from her first to walk through the latest data. And we're very pleased to then have three industry leaders to help us digest these results and more importantly, talk about what's coming in the next few months. So welcome to Emmy Augustini. She's the executive director from the National Association of Dental Plans. It's great to have her on. We've been trying to get her on for a few webinars to give us the perspective from the dental insurance market, both in terms of any additional data, as well as some of the challenges that stakeholder group is facing. John Last, we're happy to have John back. John is the president of SLRG, which is Sports and Leisure Research Group, but he's also part of a consortium that operates the Back to Normal Barometer, which in our view is the best polling of consumers related to COVID issues. You'll see John in a sec. And then Roger Levin, we're pleased to have back as well. He is the CEO of Levin Group, one of the top consulting firms in the dental space. Before going to the COVID specific data, I do want to just make sure you all know HPI last week out of our consulting arm released a really interesting report. We actually months ago polled the industry and said, hey, what information are you interested in, specifically on the manufacturer distributor side? And we were told, hey, we'd love to know how dentists are adjusting their purchasing habits when it comes to supplies and equipment. So we did that. So we released this report, which is 150 pages of data tables and all sorts of details, but we have a short 3-4 page summary of the key insights. And you'll see here, we cover things like what are dentists' views on in-person visits from sales reps? What are their intentions around what type of equipment they plan to purchase in the next 6 months? Some really interesting results there. Anyway, it's very, very affordably priced. It's $400. Lots of insights. If you're an equipment or supply manufacturer distributor, we did this for you, and I promise you, you'll get great insights here on how dentists are changing in terms of how they want to interact with sales forces. Anyway, that's at ada.org/HPI. You can go look at the table of contents and purchase the report. I will skip our methods. We've gone through this each week. You can get more on our webpage. But now let me turn it over to Chelsea to walk us through the latest findings from the week of November 2nd.
Thanks, Marko. We'll kick it off here with an update on practice operating status. Those of you who have been following us for some time might notice some slight changes in the presentation of this data, which I'll walk through today. When asked, what is the current status of your dental practice? 99% of dental practices in the US were open as of the week of November 2nd. This green line, however, indicates those who report open and business as usual in terms of patient volume. As of the week of November 2nd, 38% of practices were open and business as usual, representing a decline over the past couple months. Let's take a closer look at patient volumes. When asked, how does this week compare to what is typical in your practice in terms of total patient volume, we found that on average, nationally, patient volume in dental practices is at 77% of pre-COVID-19 levels as of the week of November 2nd. Again, a slight decline over the past month or so. This is an update of our COVID-19 cases and patient volume data state by state. On the x-axis, we have the number of new COVID cases per 100,000 people in the state from early October to early November. The y-axis is the change in dental patient volume in that same time frame. Note that very few states have increased their patient volume over that period. Just those in the top left, like Kentucky, Kansas, Nevada, Washington, that lie above that solid line. The dotted line shows that there is a relationship between COVID-19 cases and patient volume at the state level. States with a greater increase in COVID-19 cases in their populations have experienced a greater decline in patient volume over that month. The Bureau of Labor Statistics recently released employment data for October 2020, comparing October levels to January 2020. The green line indicates employment in dental offices, red is for physicians' offices, and yellow is other health practitioners' offices. Staffing in dental offices is at 97.5% of pre-COVID-19 levels as of the end of October. This has risen steadily, but very slowly since the summer months. We've been tracking PPE in terms of days of inventory. How many days worth of the following PPE does your practice have at this time? N95s and KN95s, surgical masks, face shields, gowns, disinfecting supplies, and gloves. We go from red on the left of these bars, indicating 0 days supply, to green on the right portion of these bars, indicating more than 2 weeks supply. Overall, this hasn't shifted much in recent waves of polling. PPE supply was stable for the week of November 2nd, but gowns, N95s, and disinfecting supplies remain an issue for some. We'll be keeping a very close eye on this in the coming waves of polling. Now for our questions of the week. Here we ask panelists to describe their practice's profitability before the COVID-19 pandemic, the chart on the top, and now, the chart on the bottom. Moving from left to right, or darker to lighter shades of teal, we go from highly profitable, somewhat profitable, breaking even, somewhat unprofitable, and highly unprofitable. Up top, you see that 95% of dentists had highly or somewhat profitable practices before the pandemic. But down below, 60% of dentists report being profitable now. 27% are currently breaking even, and 13% report being unprofitable, compared to just 1% being unprofitable before the pandemic. Now we have a few questions pertaining to student loans. The top graph captures panelists who have remaining federal student loans, about 20%, and private student loans, about 14% of our panel. Among those with private student loans, we asked if their lenders were offering deferment or any other type of support during the public health emergency, as federal lenders were required to do. Over half report that their private lenders did offer deferment or other supports. 19% were unsure, and 27% said no supports offered. We also inquired about the stress level panelists' student loan situations have caused before the pandemic, up top, and since the onset of the COVID-19 pandemic, down below. Panelists indicated their stress levels on a scale of 1 to 10. As you can see, comparing the top to the bottom, there's been a modest increase in the stress level caused by student loans since the onset of the pandemic. Here we asked, in an effort to reduce aerosols, has your practice's use of the following changed compared to before the COVID-19 pandemic? Working our way down this chart, you see hand scaling, use of SDF or silver diamine fluoride, glass ionomers, fluoride varnish, and dental sealants. On the left portion of each of these bars, that darkest shade of teal, that indicates the share of dentists who have increased their use of those techniques or procedures or materials in practice. In the middle, we see those who said it stayed about the same. And that lightest shade on the far right are those who say their use of this has decreased since the onset of the pandemic. Roughly 2/3 of practices are doing more hand scaling compared to before the pandemic. Nearly 1/4 are using more SDF, while 13% have increased their use of varnish and 11% have increased their use of glass ionomers. Now we'll shift gears briefly to share some data from consumer polling. We've been partnering with Engagis, a leading consumer research firm, enabling us to collectively explore consumer sentiment toward visiting the dentist during the pandemic with a nationally representative sample of household respondents. We're fortunate to be joined by John Last from that team today for our panel discussion, so you'll hear more from him shortly. HPI and Engagis have been keeping an eye on this pie chart for quite a few months. When we ask consumers, those who are dental utilizers, those who had a dental visit in 2019, about their thoughts on visiting a dental office, this is what we see. 23% have already been back. They're recently active. 60% are ready to go. When their next appointment comes up, they'll show up. 5%, that sliver in yellow, are still seeking assurances. They need a little extra confidence and comfort that it's safe to return before they'll be back. But this has shrunk a bit. And 12% in red will need a medical breakthrough. These folks might be waiting for their vaccine before they'll be back in a dental chair. And that just about takes care of our updates from the week of November 2nd. As always, many thanks to our dedicated panelists for their time and effort on a biweekly basis that allows us to take this pulse on the dental care sector. This summary information will be available online shortly at ada.org/HPI, but I'll go ahead and turn it back to Marko so we can get to the panel discussion.
Hey, thanks. I'll just leave this up for a sec, Chelsea. So I think, again, recovery, as you mentioned, right? We're kind of seeing patient volume stall and potentially decline slowly. As you mentioned, states with really high growth in COVID cases seem to have a bit more of a clawback in patient volume, although, as you mentioned, that relationship is weak, I would say, although it is present. And just on the third point, we're definitely going to get into this with the panel. But 27% of dentists breaking even and another 13% losing money. That's 40% of practices at break even or worse. I think one of the things we want to get into the panel is like, how sustainable is this? So anyways, a big thank you to Chelsea. What we're going to do now is I want to bring the panel back in. Let's go ahead and unmute yourselves and start your videos. So Chelsea, can you just introduce yourself quickly, just so folks know who you are?
Sure. Hi, everybody. Thanks again for joining us. I'm Chelsea Fosse. I'm a dentist and joined the team at HPI in July as their senior health policy analyst.
Okay, Emmy.
Yeah, hi everyone. I'm Emmy Augustini, the Executive Director of the National Association of Dental Plans. Thanks for the invitation, Marko and Chelsea, and of course for compiling this information throughout the pandemic. And a big thank you to many who are listening and continue to contribute by responding to the survey. Thank you.
Yes, thank you. Good. John?
Thanks for having us. I'm John Last. I'm the president and founder of SLRG, Sports and Leisure Research Group. We, along with Engagis, have been doing the regular pulsing of consumer and patient attitudes through the Back to Normal Barometer. I'm a former national president of the Marketing Research Association, as well as Marketing Research Institute International.
And then Roger, just say who you are and say hello.
Hello, it's a pleasure to be with this panel. I'm Roger Levin. I'm a general dentist who founded in 1985 a practice management consulting firm called Levin Group. I am the active CEO and very excited about our meeting today.
Okay, wonderful. So again, to the audience, the slides will be available, as Chelsea mentioned, as well as a recording. Keep the questions coming. I see there's already a few coming in. But let me kick it off. I had a few things I wanted to just do as conversation starters. As usual, I want to see what surprised you or what you were like, yes, 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 that's confirming what I'm hearing. And let's go reverse. Roger, why don't you kick off very briefly?
Sure. Two things surprised me. Number one, dental practices have held up better than expected through October and into part of November. We had built a 24-month COVID recovery timeline model, and we thought by month 5, from June 1st, 2020, we'd start to see the pent-up demand beginning to wane, which would affect practice production. It looks as if it's just starting to happen now in the last week to 10 days. The second surprise was the number of staff members that did not return. Chelsea pointed out that 97.5% of staffing capacity has been handled, but what that doesn't show is the number of staff that did not come back or came back and did not remain and now have been replaced. So I end by saying that I think staffing will be possibly the number one challenge the practice itself might be facing going forward, along with economics.
Great. John?
I guess the biggest surprise to me was to see the shift in profitability, something that it was just kind of curious to see that happen as rapidly as it appeared to based on the data. Among things that were very consistent with what we've been looking at on the demand side, and I know we'll probably get into this a little bit later, was the leveling off in patient volume, which is pretty consistent with what we've seen in the barometer from the end of the summer through the first few months of the fall.
Okay, great. Okay, and Emmy, surprises or things that confirmed what you're seeing?
I think we'll talk in a moment about utilization, so I may save that. But one thing that seems maybe new, and you can correct me, is if there is somewhat from the last time that you reported a relationship between COVID cases and patient volume, if that is even strengthening just a little bit from the last time that you reported it. So that was kind of an interesting observation that you've continued to compare.
Yeah, and I don't want to over infer from that chart, right? It was a very simple, we haven't controlled for things we should be controlling for in more formal analysis, right? But it does hint at a potential relationship. I would call it weak. Chelsea calls it weak as well. So we shouldn't read too much into it. But I think, as you mentioned, Emmy, it is stronger than it was a month ago when we did that same chart. So maybe something is there. Yeah. But very good. Okay, so I want to ask now very bluntly, are we at the beginning of a slowdown in patient volume again? And let me start here. Emmy, maybe you is there additional data from the payer side that maybe sheds light on this? Obviously, our data are self-reported and they're averaged across thousands of practices. We think it's nationally representative, but it is self-reported. Is there anything to contribute on this? Like, are we seeing a slowdown in patient volume now?
Yes, that's a great question, and one that I'm happy to provide some insight on. And first, I think it'd be good if I gave some context for the recent utilization data that we're seeing and offer some comparison to perhaps the dentist experiences you've seen through the survey and since dental offices have reopened. First, it might be good to cite my sources. We are now collecting utilization data on a quarterly basis where carriers are reporting monthly data. Unfortunately, we are in data collection, cleaning, analyzing, publishing. I only have concrete information for the second quarter. We're doing that work for the third quarter, and I won't have it till the end of the month. So I'm sorry, it couldn't happen before this webinar. But some of our second quarter data, it will track with your observations. Benefit utilization saw a drop in April and into May when dental offices were closed for all but emergency services. But interestingly, in the last month I have data for, June, we saw utilization up 14% compared to the same time in 2019. And this experience, I imagine, and the experience of carriers through to today will vary by region or state. But I've kind of learned more from carriers more broadly that this experience did continue through the summer and into the third quarter. So some are reporting utilization rates of 95%, 105, 108, 112% of pre-COVID levels, or compared to 2019 experience at the same time. This, again, it's going to vary regionally, where a carrier has business and sort of the mix of their businesses. But the bottom line is that over the summer, utilization of benefits reached, if not exceeded, pre-COVID levels. And I think comparing this to the patient volumes being reported in the Institute's surveys shows that those with dental benefits are utilizing dental services, perhaps more than those without benefits. And dental benefits, therefore, we think are playing a really important role in getting folks back to the dentist, and could, really explain some of the difference that we're seeing. This could speak as well to maybe the experience of cash pay patients, and a potential hesitancy to return to the dentist for financial instability. That would be probably speculation on my part. Another factor, that could be driving utilization is pent-up demand that we expected. Maybe there was more of a triage situation happening where you're rescheduling patients and treating those first with more complex or extensive condition. But I guess to bring it all the way back to your first question, which is more recently, the last month or so, I'm starting to hear observations of a decrease from those numbers at above 100% that I mentioned to perhaps below. Could still be above 90% or around there, I don't know. And given the time frame for when claims are submitted and processed and paid, of course, there's going to be a lag in any data that I have. But this picture could actually end up changing. But I offer that as perhaps some small confirmation of the observation that you're seeing, of perhaps some sort of slowdown, with a caveat, though, that I think utilization may still, for carriers, it's going to hover closer to normal levels relative to the patient volume that dentists are seeing in the survey.
Roger, I want to bring you in, but let me ask you maybe more specifically, right? Because we track just volume. We don't look at the type of procedures or the mix between prevention, recall versus acute issues or pent-up demand. So, and I know a couple questions have come in already about this issue of recall schedules being messed up or miscalibrated. Can you shed light on this? Have we worked through pent-up demand and now there's an echo? Or
Absolutely.
Is this an issue of procedures falling across the board?
I think there are a couple of different factors that are playing in. Number one, Emmy, I think your third quarter is going to look very strong when the data comes in, because that was pent-up demand. In fact, there was so much pent-up demand that one more thing that surprised me was the level of fatigue and burnout that was taking place in practices. As that has abated, starting toward the end of October, we thought it was going to be a month earlier. There was a mitigating factor that was referred to colloquially as the big dip. In October and November, a lot of general practice hygiene schedules went light. And they went light because patients were off cycle. Basically, they had missed April and May. There was a big crunch in June and July. Most practices operate under the thesis of wait 6 months before the next hygiene appointment. Many insurance plans require 6 months in 1 day. So that was one factor, but that had more to do with simply being off cycle. We are, Marko, starting to see a softening, a predicted softening of practice production. At the current time, we're seeing it down around 5 to 10% as the pent-up demand has now been taken care of and the underlying fundamentals are kicking in. But as Emmy pointed out, there's another mitigating factor, which is patients who either have lost jobs or are concerned about losing jobs or know they're going to be leaving jobs, utilizing their dental insurance now to get their final round in the practice. So that's actually picking production up a little bit. And I think January is where we're going to see the reality of how this shakes out.
Very good. Okay, John, let me bring you in start with the consumer angle on this question. There are a few questions coming in on, does anybody foresee state governors going back to recommending delays in elective care? Okay, let's park that for a sec as part B of this question. But part A of the question, John, is we're seeing COVID cases spiking in the vast majority of states. We're hearing governors debate about what they're going to do with restrictions and things like that. From the consumer side, where is dentistry in terms of the mindset? both in terms of comfort going back, safety levels? What can you share relative to other activities? Because the real richness of your data is you compare dentistry to a whole bunch of other things, including healthcare.
Yeah, no, thanks, Marco. There's really been some interesting phenomenon that we've looked at throughout the barometer. I want to first corroborate what both Emmy and Roger were suggesting in terms of the volume trends that we've seen. We've tracked consistently the percentage of past year patients who have gone back to a dentist within a 30-day period, and that did drop from about 26% to 23%, still within the margin of error, from peak period at the end of August through the first couple of months of the fall, and that did abate a little bit. But to your initial question about where the profession sits relative to other activities, one of the things that's really been compelling within the barometer is that, you know, certain essential activities, and we've defined them as not only healthcare related but retail, have dwarfed other activities in terms of the incidence of people going back to them. And to kind of echo what Chelsea shared in her remarks, that high percentage of people who are ready to go and or have recently re-engaged. So you saw those numbers for dental practices, and that frankly is within shouting distance of what we see for doctors' offices and retail. And then beyond that, there's a real marked decrease in the percentage of those who have done more discretionary activities, such as staying at hotels, flying on planes, taking a cruise, visiting homes for sale, where those numbers have kind of risen up since the depths of the data back in the early summer months to about 60 or 70%. We're seeing, you know, high 80s within these essential activities. So I think it's important to understand a little bit as well from what we've collected, the rationale behind that. And a lot of that really comes to one of the major themes that has been pervasive throughout the barometer, and that is about consumers putting themselves in scenarios where they feel in control, areas where they feel that the necessary precautions are being taken. And one of the great benefits that the dental profession has accrued relative to others is that there has always been that perception, and we've seen this in our qualitative work as well, there's always been that perception that the profession has been ahead of the curve, that those behaviors, that the utilization of PPE is part and parcel to standard operating procedure. So that, I think, has gone a real long way, where one might have thought, you know, gosh, intuitively, here's, you know, people working very close proximity to me, but yet there's still that feeling of safety and control, which has been consistent throughout the barometer.
Very good. And just for folks on the webinar that don't know, a couple weeks ago, a very big paper came out in JADA, a collaboration with my group and our science team, looking at COVID infection rates among dentists. And it was very low. It was like less than 1%. And again, one of the conclusions, one of them, was that it appears that the new infection control protocols, with millions and millions of patients being seen since reopening, according to the CDC, we don't have any confirmed cases of transmission in the dental office. There obviously have been positive results for clinicians and the dental team, but not via the dental office. And partnered with this research showing very low infection rates among dentists. It's encouraging, right? We'll continue to monitor this, but it does seem, like you said, John, the public is getting the message that there are new protocols out there, that dentistry is safe. And there's been a long history of that belief as well. Anyway.
If I could add to it, Marco,
yeah.
one other thing, you know, in terms of trust that we've seen is that there seems to be very much a strong and trustful relationship between the patient and their practitioners. We recall we had asked a question in the barometer earlier where we posed a scenario that if there had been a reported case of a COVID transmission at a dental practice that wasn't their own practice, how would that impact people's willingness to go back? And the impact was fairly minimal. People, again, kind of seeing these situations as very much localized.
Very good, very good. Yeah. I want to keep going in this vein. There's so many questions coming in actually related to this. Okay, so if I forget, make sure I ask you about predicted shutdowns again. But Roger, on this issue of patient volume as a percent of pre-COVID levels, right? So given the new protocols in place, it's not feasible to have 100% of the patient volume as far as, I mean, first of all, do you agree with that? I would think you can see fewer patients, period, because you're spacing them out more. A lot of dentists are chiming in. They're having trouble recruiting staff, particularly hygienists. From where you sit, like, are we at capacity in the system, or can we absorb a lot more patients? Are there lots of open chair time slots?
Well, if we go back 3 months, well, first of all, Marko, I completely agree that the volume is down. We're showing it around 79, 80%. There are ways to increase the volume by 5 or 6% that I won't go into today. That's practice management. But if we go back about 3 months, practices were at capacity, again, due to pent-up demand. We saw many hygiene schedules in October and November decline by anywhere from 20 to 40%, depending on the practice. And dentistry typically never reverses once we put in infection control procedures. So even with a vaccine, I'm not optimistic that we will be reverting back to what we did pre-COVID. Maybe someday if it's completely eradicated. So at best, we project about 85% of pre-COVID volume. Now, as the demand for services is beginning to just slow down, literally starting in the last 7 to 10 days for general dentists, which means in about 2 or 3 weeks for specialists, they'll be able to see not a higher physical capacity of patients, but they'll be able to accommodate the patients that they have more conveniently and more easily.
Okay, excellent. Now let's get to the question. Is anybody foreseeing a state going back to recommending emergency dental care only? I certainly know from the ADA perspective, I mean, we just released their statement last night saying, no, we don't think that needs to happen. Dentistry is essential. The protocols are in place. If practices can follow them, then they shouldn't close. Anybody else want to chime in on this? I don't know. Let me go around to Emmy. What would you predict? Would you foresee this as a real risk?
I hope not.
Okay.
Dental is essential. Folks need to get back in to resume their care or continue their care to avoid disease. I think the lockdowns or sort of measures that I've seen so far have been fairly targeted. So perhaps the lesson has been imparted that going back to the dentist is safe. And so states are thinking about those activities that folks are engaging in that has the real risk of transmission of COVID. So gatherings or events and that sort of thing. So that's where these things are moving toward. I think it's possible that New Mexico, something about the order from the governor there might have spoken to essential or emergency dental care, but I'm not recalling off the top of my head. Perhaps somebody could comment in the Q&A and correct me on that.
Okay. Chelsea, let me ask you, anything to add on this in terms of whether we think we'll go back to this close down?
Yeah, I mean, I think we've seen one based on the paper that was released by the Science Institute and HPI that the vast majority of dentists have accepted these enhanced safety protocols. And because of that, I think we've really proven to the general public and to authority figures that really it is safe. And as long as a patient feels comfortable and needs to be seen, that they should be able to get back into their dentist's office.
Good. Good. Okay, let me get to some of the audience Q&A as well. One related to Medicaid. Are we seeing any sort of movement of dentists dropping out of Medicaid because of either higher PPE costs or things like that? Maybe Chelsea, can you start with that? I know we looked at this some waves ago.
Sure, we have seen some Medicaid providers drop out or are no longer participating in Medicaid, and we do continue to follow up on that in the very near future to see where that lies now. I think on the enrollment side, there's been some information that has been touched upon already today, but we do know that there's been a not insignificant drop of people who have employer-sponsored health insurance and some part of that dental insurance as well. Some of that might be absorbed by Medicaid, CHIP, and other non-group dental plans. So it'll be interesting to see what we learn on the enrollment piece of all of this too.
While I have you, anything updated on our practices open later, longer hours, any kind of adjustments, or I don't think we have any recent data on this.
We don't have recent data. We did see in the summer months that people had, that many folks, or sorry, I shouldn't say many, but there was a share who had expanded hours. It'd be interesting to look at that now and see if people have consolidated schedules more so, but we do not have updated information on that since the summer.
Roger, anything to add on that?
Yeah, during the summer, we did see many, Chelsea, I think your word was right, practices with expanded hours as they were trying to make up lost income during the shutdown. In the last 60 days, we've seen many practices revert back to normal hours for 3 reasons. One, they intended to. Secondly, the staff was starting to push back on the number of hours they were being asked to work, or there were staff shortages in terms of situations like a staff member with children at home who suddenly found out the kids were not going to be going to school, and daycare became a factor. And third, as patient volume is slowing down now and the pent-up demand is completed, they can't necessarily fill the expanded hours the way they were this summer. So we are seeing a large pullback on those now.
Okay. How about the PPE side, right? So there's obviously kind of governor's orders that affect whether dentists can open or not, but there's also, can you adhere to the protocols? And PPE is a big one. Now, Chelsea was very clear that we haven't seen, at least the first week of November, any big kind of reduction in PPE stockpiles in dental offices. What do each of you foresee in the coming months for this? Obviously, as COVID cases rise, I mean, the medical side is hospitals are going to need more PPE. Have we fixed the supply chain? Is this going to be an issue? And Roger, let me start with you. And
Sure.
I don't know is a perfectly good answer, but
Well, I know my limitations. I can't speak to what hospitals will need or the complete supply chain, but we are not getting any reports from hundreds of offices around the country weekly that they are not able to access PPE or that they're concerned about their ability to access it in the future. Not to say that couldn't happen, but right now that's not a concern amongst most dentists that we're speaking to.
got it. Okay, anything else to add, Emmy or John? Okay, good.
If I
All
may,
right.
Marko, can I just add one quick comment? So I think one thing we're hearing about is that the particular supply, the type of glove you're interested, getting an N95 over a KN95, that remains an issue and could worsen in the time to come. We'll see.
Good, okay. Chelsea, while I have you, the profitability data you showed, like the break even, highly profitable, mildly profitable. Any insights you can give on variations? Rural, urban, large group, solo, DSO, non-DSO, anything that came out interesting?
Sure. I think one of the most important or striking variations was when we looked at those dentists who are DSO affiliated versus non. And we did see that the profitability did not drop as much in DSOs, nor did it drop as much in large group practices as it did in non-DSO affiliated or solo small group practices. Those were really the striking differences in terms of the profitability. One other note on that, we did see that female dentists were reporting lower profitability pre-pandemic and a greater drop in profitability now.
Okay. Emmy, anything to add on the procedure mix? So if we look at trends over time, are we back to kind of pre-COVID levels in terms of the mix of restorative, preventive? I don't know. We've heard lots of stories and we had data about more cracked teeth and more bruxism, grinding, etc. Is there anything you can just even anecdotally from payers share?
Yeah, unfortunately, I don't have data, but from what I'm hearing, so this is anecdotal, we are returning to a more normal mix, but for a time, I think some carriers were seeing or reported higher per claim costs, indicating that maybe there was more care being needed to provide per patient. I think this could be better answered, honestly, by a practicing dentist, but perhaps this was related to the desire to prevent having to recall or schedule people for a second visit if it could be done in one. I think, of course, what we fear most, and we won't be able to measure yet, is that delay in getting preventive care will exacerbate dental conditions, leading to pain, also requiring intensive and expensive intervention, and leading to missing some clear warning signs for medical conditions that can manifest in the mouth. This is something, though, we can't yet see, but recognize when we talk with employers and enrollees about why it's so important to re-engage with your care, but we just don't have the data yet.
Okay. On PPE, by the way, there's lots of stuff in the chat. I'm not gonna respond. I've been responding to things as we go as well. That things I can't ask you all. There's just so many questions. Lots of things on glove prices and shortages and limits to how much dentists can order, et cetera, et cetera. So obviously this is something we're going to continue to track, right? And keep an eye on. But at least for now, there wasn't any huge kind of reversal in the data. Emmy, I'll start with you on this one. Prospects for job losses and continued economic sluggishness potentially, and how that relates to the number of people covered by dental insurance. So I saw something, I don't remember where it was last week, saying we're going to have 10 million fewer Americans with dental insurance. I don't know, by Q1. Is there anything you're hearing? Are the number of enrollees declining in your membership groups? Are people losing dental insurance?
So I'm happy to provide some perspective, as well as I think I've got some new data sort of hot off the presses from a survey of employers that we fielded at the end of October. So I can share that too. Okay. But most of the studies that I've looked at, some of the ones you're speaking to, they try to model the loss of employer-sponsored insurance. And those numbers are ranging anywhere from 5 million to 20 million. Now they could differ in whether or not they include dependents. But those analyses, they seek to try to find how many permanent job losses we can expect, how many of those jobs conveyed health insurance, and then how many of those who lost coverage will be eligible for programs like Medicaid or the exchanges, and ultimately how many will then be uninsured. And most of these studies focus on medical insurance, and any dental study that I've seen then tries to extrapolate from that. So for each of these kind of questions that they seek to look at, I can tell you how I might apply a dental lens. So the dental numbers will trend with major medical on the employer-sponsored side, given that it's the most requested benefit after medical and pharmacy, with maybe a couple caveats that employers who do remain in business and continue to offer a benefit may need to contribute less to the premium, or employees who may feel insecure about their job, or maybe they lost a job in the family. They may want to preserve disposable income and won't continue their benefit, or they will choose a less rich benefit. So these dynamics are of course great interest to carriers, and we're doing everything that we can to help folks maintain their benefits. I can talk about those programs. But thinking again about those predictions and thinking of them for dental, some of those who lose coverage are going to be eligible for Medicaid. But where think tanks estimate a gain in coverage through the program, I would temper expectations for dental, because we know a few states don't offer any dental benefit for adults. About 29 states offer emergency or limited benefits. Those will not be as rich as the benefits that a person had through their employer. Unfortunately, those benefits as they're offered today in Medicaid are also under threat of budget cuts given state budget challenges. And we thought that adult dental benefits would be preserved with certain maintenance of effort requirements under the law and under the CARES Act, but CMS has just issued an interim final rule that relaxes this requirement. And really very concerningly, they state within the preamble of the rule that the change that they're implementing, states could implement, or excuse me, they could eliminate dental services for adults and still get increased FMAP funding. So I think we thought that we would be able to protect adult dental benefits through the end of the year because of this law. I'm very worried about this now, and that's a digression, but Medicaid is a program that really needs attention and some strong advocacy at the federal level right now. But again, if I go, yeah.
I like how you tied in that the job losses generally in the private sector have put a lot more adults in Medicaid, and we have seen the enrollment in Medicaid go up, right, since because of the economy. Whereas
Right.
that maybe doesn't affect the healthcare side as much. It certainly affects the dental side significantly because a lot
Right.
of states don't have any sort of coverage. And even those that do, I wouldn't call it comprehensive in all cases.
Right.
Let me shift
Right.
gears a bit here, bring in John on the consumer side. So Chelsea showed your data that there was a share of the public basically saying, I'm not going to go back to the dentist until there's a vaccine, right? And we've been kind of in HPI saying, okay, once that happens, and eventually it will, we're likely to see a huge inflow of more patients. First of all, talk about whether that assumption's right, but more importantly, can you start with where are we on the public sentiment toward vaccines? We just saw news this week about two companies, right, Pfizer and Modena, who look very promising results. Assuming we have a vaccine sometime early next year, is the public going to take it? Is this going to really bump up dental demand?
So I think on the one hand, I'm not sure how much more demand there is to bump up, just given the near ubiquity with which past year patients have come back.
Okay.
That said, I mean, we are seeing in the data, and as Chelsea pointed out, there still has been consistently about 15% of the prior year patient volume that says they will not return without a vaccine or an ethical protocol to mitigate the impacts of the virus. We've seen an increase, and we just have new data in today that I haven't had a chance to look at, but we have seen a slight increase in the incidence of those who are expressing their desire to get the vaccine and to do it as quickly as they possibly can. So I think that's encouraging towards eliminating or lessening that 15% that has kind of held back looking for a breakthrough. That said, I think we need to be a little bit cautious just because there always seems to be a haircut between what people express as their intent versus what they do. In the latest data that we've seen in terms of actual incidence of those taking a flu vaccine, for example, I think the latest data was from 2018, and it was about 39% who actually took a flu vaccine. We're looking in the mid to upper 50s from what we've seen in terms of the possible COVID vaccine. So I question, on the one hand, whether it will be a opening of the floodgates, so to speak, in terms of return. But I think on the more positive side, the data that we've been collecting shows that both for preventative care, maintenance care, as well as emergency care, we've seen people begin to come back, and the big push that I think both Roger and Chelsea talked about has certainly been evident from a demand standpoint as well.
Okay, interesting. So again, it's great to have your perspective that looks across all sorts of sectors, that we're doing relatively better than a lot of other sectors in getting patients to re-engage.
Yeah, I mean, just to emphasize, that breakthrough percentage number, which is around 15%, I mean, we still see that number in the 30s to close to 40s for sectors like air travel and movie theaters and more discretionary activities. So, on the good side, that means that the industry and profession has done a great job of building that trust. On the less than good side, it is that there's maybe not as much upside.
Okay. I want to ask Roger about what this is going to do to like retirement rates and practice sales. But first, Chelsea, a couple of things came in on the FKC side. Just summarize, are we seeing elevated trends like this in dentists working in public health settings compared to private practice? We haven't talked much about the data today, but what do we know?
Sure. So the patient volume numbers consistently have been lower with our public health panel than with the private practice panel data that we've presented today. So definitely, I think we've covered this in some of the past webinars, and nobody has all the answers here, but I think there are some real capacity issues, and there are also a new set of issues in terms of engaging those patients again and getting them back in the dental chair. So the information from the public health panels are also available online.
Okay. All right, Roger. So there's been research released this week showing physicians. There's a bump in physicians exiting the workforce, mostly retirement age, right? The punchline is this is accelerated into retirement by a factor of X. We've also seen even businesses who's been receiving PPP loans from the government, some share of them are bankrupt now, right? So there's financial relief, there's a whole bunch of other things. Chelsea showed the data on 13% of practices are losing money, another 27% breaking even. I guess, let me open it up. What are the prospects here if we're roughly in a holding pattern in terms of patient volume and there isn't any massive injection of financial relief? Like, are we going to see a reduction in the number of practices in the next few months? Are we going to see a bump in retirement, bankruptcies? I mean, from where you sit, what are we going to see?
So I'm generally optimistic, extremely optimistic for the profession as a whole. We will come through this. John, somewhere this vaccine will hopefully benefit us. We still think 2021 will be a bumpy year. We think 2022 will be a good year. But having said that, Marko, I do have to deliver the bad news that we have predicted from early on, and we are still projecting that 10 to 15% of practices could disappear. And the problem with the data is that typically we look at bankruptcies, and in dentistry, the closure of practices is not always based on bankruptcies the way you see in restaurants or other fields. So we've seen already a number of doctors over 65 who decided not to reopen. Now, the mitigating factor there is financial independence. These were doctors who could walk away. They said, I'm not coming back. They either just shut their doors or they gave their patients to another dentist. They're not coming back. And that was the early on effect. But with Chelsea's data, and we're seeing that the weaker players, once the pandemic hit, we're now turning into break even or non-profitable. We're going to see 3 to 4 different scenarios. We might see bankruptcies, but a small, that might be 1 to 2% of the mix. Then we're going to see closures, which nobody's really measuring. Then we're going to see mergers, which nobody really measures. We're going to see buyouts. And then a minor category is just giving away my patients, which we put under the closure category. I'll hand my patients over. So sadly, we do think that about 10 to 15% of practices, I know that's a wide margin, will not be here December 2021 for one reason or another, but they're all economically driven in the decision-making.
Excellent. Let's dive into this. But Chelsea, give the stat, because we asked about intentions about retirement a couple waves ago, and just chime in on what we found.
Yeah, so we saw that there were a small amount who were raising fees, who were dropping out of insurance plans, some many more who are considering doing this. And at the time we asked through the end of the year, we'll be following up on this soon. So definitely more that are considering selling practice altogether, perhaps joining a DSO, and a sliver or two considering early retirement. So something that we definitely want to continue to track.
But it was 40%, right? 40% of dentists 65 and older indicated that if patient volume remained stable and did not climb much more, they would seriously consider retiring. We asked this, I think, in October, and we said by the end of the year.
Yeah.
Our data haven't picked that up yet, to be very clear to everybody listening in. We haven't seen an actual mass exit yet, but the intentions that dentists said were quite high. I mean, that's a significant outflow. Interestingly, what's really different this time around compared to like the 07-08 economic crash, right? Like obviously the drivers are totally different. But if you remember back then, there was a big increase in retirement age, right? Dentists ended up working much longer, largely because of the asset bubble bursting, right? 401ks diminished, property values diminished. That's not the case now. So the BLS actually just picked up in general in the economy, an increase in retirements, because people are like, hey, the stock market's doing okay, the housing market's doing okay, asset levels are good. We're not seeing that crash, right? So I actually think because of that, and I'm sure that's the same with dentists, late career, right? It's the nest egg is there, whereas in 07-08 that nest egg shrunk. So I think Roger, I'm with you. I think we will see early retirement or earlier than expected in the coming months. Somebody asked the question, what does that do for prospects for young dentists? Go ahead and comment, and then if somebody wants to answer that question.
Well, quickly, it's interesting that we're getting a lot of calls right now. This is anecdotal from young dentists asking if they should buy this practice, that practice. And I won't get into the, what they should or shouldn't do, but there's a lot of opportunity out there. Whenever you have a crisis, you do have upheaval in the industry, which is most industries right now, John, right? And unless you're in the PPE manufacturing industry. And we're seeing a lot of upheaval. So a lot of young dentists are picking up practices. But the other thing, Marko, as you know, many dentists, and I wouldn't call them DSOs yet, but they had 1, 2, or 3 practices. They want to go to 5 or 6. And they're picking up the practice a mile away, 2 miles away that's shutting its doors. So we're going to see more practices owned by the same corporation, so to speak, than we did in the past. That didn't happen in 07 and 08. Dentists weren't looking to acquire practices. And the other factor that I'll mention quickly is the reason we haven't seen the effect yet, it's coming, is the PPP money and other loans. As that's running out and we're not able to access more lending and borrowing, that's when the practice fundamentals will start. That's when that lack of profitability or break even will lead to a decision to walk away in some way, shape, or form.
Got it. And then somebody was asking too about, okay, will the outflows outweigh the new grads coming in, et cetera, et cetera. Our modeling indicated, like pre-COVID, we were on the way to a steadily rising supply of dentists. We haven't crunched the numbers whether a bump in retirement now means that that's larger than the additional inflows, et cetera. But directionally, I think what Roger mentioned is very, very important. Look, we're getting close to the end of the time. I've been working hard. I don't know if you heard me typing away, but I've been answering as many as I can. You've all been phenomenal. Let's get some closing thoughts here. I don't have a specific question. Just give us maybe some things HPI maybe should be tracking from your perspective that maybe we're not. If not, tell us where you think we'll be early January. Roger, you're great at giving us optimism, right? John, you can tell us about where the public is going to be. But let me start with Emmy. Any closing thoughts on what you've heard or what you think we'll see?
Sure. Well, and I think I referenced earlier when I started talking about enrollment that we might have had we do have late breaking news from our employer survey, which has some optimism relative to some of my more negative outlook. But what we found, and in surveying, and we're asking employers about their staffing plans for next year. So this is the outlook we're thinking about for carriers, customers, and the employers we serve. But 56% of employers report that they plan to hire staff next year. The remainder saying no change or small job cuts. So that's good news. Another good point. When asked about expectations for the next 6 months, 67% of employers expect business conditions to improve. Now, maybe that's because things can only get better at this point, but I think I'm going to take that as a positive sign and offer it to you all as well for some optimism.
Excellent. Okay, Roger?
I think we're heading toward, in the next couple months, stabilization. Just like you've referenced, patient volume is stable. And patient volume, by the way, ties directly back to practice production. That's I think, the interpretation by a lot of dentists. I think that 2021 will be a bumpy year, as I said, but not a bad year. And that the practices that are going to make it, which is the vast majority, may not be hitting their 2019 levels. That was a great economic year. We have to keep that in mind. But we're going to see a return to stability. And I'm with a lot of the economists and investment gurus out there that think that 2022 will actually be a good year, given if the vaccine does everything we're hoping it will do. So we're seeing a shakeout. We're seeing changes in the profession. Keep in mind that not everybody selling or closing is leaving. Many will seek jobs within the profession because they need to work. So I think we're going to see a slow, unsteady march in 21 to improvement, and then 2022 could be a slow, steadier march to continued improvement going forward.
Excellent. John.
I would agree with Roger's perspective in terms of the cadence of this kind of return back to normalcy. Our data, one of the big aggregations of our back to normal barometer is the number itself. That is basically 26 different attitudinal statements about how people are perceiving things, both short term and long term. I did get a chance to calculate and peek through that this morning, so this is the first group to see it. That number is actually maintained at where it was right before the election, at a high point from what we've seen over the last 8 months. So that suggests that, again, there is not only this growing COVID fatigue that our data has suggested, but also a certain optimism to see things begin to move forward. I'll be curious as I go into the data a little bit further to see if we're already seeing any impact of the vaccination announcements. Though to corroborate what Roger was saying, I do see it being kind of a spotty year. Clearly, the diffusion of that vaccine will take time. How quickly that will erode that 15% that's still waiting for a breakthrough before they come back to the dentist is to be determined. But I would tend to agree that we probably won't see that impact more so until the second half of 21, and then hopefully 22 becomes a more reflective year of what we had been seeing the arc be in the past.
Great. And Chelsea, just quick final thought.
Sure. No, I think one thing we didn't touch upon much here, but I really, I love to see that so many more practices are considering non-surgical caries management and adapting their typical protocols, and just thinking we've had a renewed focus on the importance of prevention. And I think it'll be interesting to see how that continues.
Wonderful. You've all been phenomenal. I've enjoyed this. I've learned a lot. I'm sure our audience is. There's kudos coming in across the board for all of you. So on behalf of the HPI team, let me thank you all for joining us. We'll do this again further up the road. And to all our attendees, hopefully we got to most of your questions and you've enjoyed it. And look for this to be posted on ada.org/HPI. And everybody have a great rest of the day. Thank you.